Hi, Dr. Sikka. Thanks for joining us today. I would
Thanks for
love
having me.
for you to introduce yourself to our audience.
Sure. So my name is Neal Sikka. I'm an emergency physician at George Washington University, and I practice emergency medicine in the ER at George Washington University Hospital. And I also spend a lot of time developing health technologies and telehealth services for our medical practice.
Mm-hmm. Great. So I'm excited to have this conversation with you because there are some myths out there related to technology, including telemedicine and anything related to cell phones, computers, 5G. And so I just want to jump right in and talk about some of the things we're hearing out in the community. The first question is there a relationship between 5G and COVID or coronavirus?
No, there's absolutely no relationship between 5G and coronavirus. You get coronavirus from coming in contact with someone else who's infected and getting the virus in you. But 5G or the radio waves associated with 5G or any of those types of things, they don't transmit any types of infection.
But where is that coming from? Because it's not just one or two people who've said something about this. I've also seen articles talking about this concern that somehow the 5G is linked. So what's the root of the confusion?
It's a good question. I don't know where that myth has come from. I think, historically we have been concerned about things like radiation coming from cell phone towers. We've been concerned about radiation even from our own personal cell phones. And quite a bit of research has been done in this area. And really there's been no evidence at all that our mobile devices, cellular devices, can cause any kind of cancers or other types of health risks with moderate normal use. So I'm not really sure. It's an interesting myth, and it's really odd. Now, I guess the only way you could think about this would be that if you are using your mobile device and you cough or sneeze on it, and then someone touches it and touches your face or eyes, that would be the only way I can relate a surface as a source of infection, but definitely not the radio waves that connect all of our internet devices.
Okay, so in a somewhat related vein is these apps associated with contact tracing. So we're seeing a lot about Google and some of the other tech giants coming out with apps that allow health departments and organizations to track people's movement to help figure out how to slow the spread of coronavirus. Should people be concerned about that? And what advice do you have about these contact tracing apps?
Yeah, that's a good question. I think, contact tracing as an infectious disease doctor, that contact tracing is absolutely critical in us controlling the spread of this virus. Because it is so contagious and because each individual can potentially infect a number of other people, being able to quickly find out who a positive person's contacts can be really important in controlling the spread. So what you want to understand is, how is the technology potentially affecting your own personal privacy? And I think it's everyone's own personal decision on how they make. So the way that Google and Apple are proposing to use your mobile device is that they essentially gather a little bit of information when you may come in contact with another phone. And that's all kept private and secure and encrypted. And really no one knows any of those interactions unless a public health authority finds out that someone is infected. And then if you had opted in, then that information could be used to try to find out if you were in close contact with someone who was positive. So the way I think about this is the good news is that it doesn't come turned on. So in all devices, you have to actively go into your settings and turn the contact tracing feature on.
Okay.
So you have control. So that's really important. Number two, the way I think about it from my own personal privacy concerns would be that it's somewhat passive, right? So I don't have to do anything, and I may be giving out my personal information. you know, when I give you my cell phone, I know I gave you my cell phone number. And so you have to decide how you feel about this information, even though it's encrypted and private and not going to be used unless it's in a dire situation, right, to find you because you may have been contacted. You have to decide how you feel about kind of passively giving your information. And I think that is somewhat correlated with GPS tracking, right? If your phone location is on, you give this information potentially passively to an app that is tracking your location, and you're not thinking about it, but that information is going somewhere. And usually those apps will ask you to turn that, you know, location services feature on. And so you've made that conscious decision, then you forget about it. And you don't start thinking about how that information could or might be used. And we know that in most cases, in any way that's harmful to you, but you know, there are a few bad actors that can make these types of things concerning. So you have to, again, decide and be active and proactive about your privacy settings in all applications. Now, there are other ways that you might come in contact. There are other countries, other applications that are being put out in the market that are a little bit more active, that might allow you to opt in to a way to find out if you were in contact with someone, or even to contact people or give public health your friends' contacts in some more visible way. And so that might be a better choice for you if it's available. So it really just depends on your own personal feelings about safety and privacy.
Yeah, I think trust is a big issue, because even though we have these phones and we carry them everywhere, the GPS is on, like you said, we don't think about it. But I think that is actually the reason people don't trust that you have to physically go and turn it on. I think because the GPS is on the phone, I think folks assume that whether you proactively go and turn it on or not, they still have a way to track you. So any additional assurances you can give people about that? Because I think trust is really the root of the problem.
Well, I think, yeah, you're absolutely right. And I think as a part of really our whole community, individual businesses, organizations, you know, think about, I work at a large university, and we're thinking about how do we reopen. A large part of this is building trust in our community and having that feeling that if we're sick, we will stay home. If we become ill, we will notify the people we know, and to really use good judgment. And if we don't build that culture of trust, then it's going to be really hard to contain this virus. Yeah.
And I know trust is important to you because you started a community outreach program related to health technology. So you want to tell us about that?
Sure. We last summer, through some funding from the DC Medicaid and a partnership through George Washington University and the Pennsylvania Avenue Baptist Church, we did start a program called Health Desk. And we really focused on trying to educate the community about how to use digital health tools. So those could be, it's a big word, but digital health tools, but it really includes all sorts of technologies that many of us use every day. And that could be a fitness tracking device like a Fitbit, or it could be your own smartphone. And then there's other types of devices that you may actually purchase or your doctor may prescribe to you that can help you manage your health better. And so our goal was really to lower some of the concerns and the lack of knowledge and build kind of advocacy among patients to ask their doctors about how these tools might help them. So for example, if you have diabetes, you might want to ask your doctor if you might qualify for a continuous glucose monitor, something that might allow the doctor to see your glucose or you to see your glucose all the time without having to prick your finger. Or you might ask them about how to download the patient portal that's available through their practice. And so that way you would have access to all of your lab results anywhere you go. So if you're out of town and you end up in the ER, you could share with me your the last set of labs. And that can be really useful in the testing I decide to get for you, or if I end up repeating other tests. So empowering yourself to use your own smart devices to manage your own health data and have more information, more feedback, and more connectivity with the healthcare system. And that also goes back to building trust, because we want to have trust between our patients and the healthcare system.
So when you're in the community, are these the things you are educating people about? Something like a continuous glucose monitor? Because I bet a lot of people haven't ever heard of that. So are you exposing them to these different types of technologies for their health?
So we're trying to meet everyone where they are. And so the glucose monitor is probably the more sophisticated side of technologies that are available today. But really, you can start with some of the most simple things. You know, look at your smartphone and see if you've completed even the in case of emergency application in your phone. So as an emergency doctor, that's really important to me, because, you know, sometimes people come into the hospital and they're really ill or they're really injured, and I can't get information from them. And if they've filled out the in case of emergency part of their phone, then I can, even without the lock screen, I can get to that. I might see their emergency contact, call their mom, their brother, their sister, and say, oh, you know, this is what's happened, so they know where they are. That's really important. Or that they might have an allergy to a medication, or they may be on a blood thinner, or something that I can't tell because they don't have their, you know, enough of their information, or they can't report it to me. So some things are really, really simple. Even simpler than that, you know, as we get older, I had to get stronger glasses, right? So it's harder for me to see my phone. I don't know if you've changed the font size on your phone recently.
Yes.
So we know that as people age, their close-up vision deteriorates, gets worse, and so we actually also know that in some older populations, as sight gets worse, they become less extroverted or less communicating with their family. And so by just increasing the font size, someone might start texting with their family again because they can see the letters. So something really simple like that is another thing that you can do to improve your health, or improve your communication with your family members who can help you with your health.
Well, I feel like we need to really get you out all around the communities, just educating people about these simple things, because we often think improving health requires huge changes that are hard to sustain, but the kinds of things you're talking about, they're so simple, and it's really already accessible to you if you have a phone. So that's great.
Yeah. I think you're right. And I think they are simple and they're fairly permanent, right? If you give you a sheet of paper, you might lose it on your way home. But if we make a change on your phone, that change can be persistent. And so you'll have it for a long period of time.
Yeah.
And I do want to mention, it doesn't have to be me out in the community. We've trained lots of community members and volunteers. So they have that same knowledge, and they can help their friends, colleagues, and peers in the community learn about these things.
So you have a digital literacy workforce.
Exactly.
We have to find ways to hire them, employ them. Yeah,
that would be great. We've put them through training. They're excellent, and they're really great at communicating. They serve as a great bridge kind of between an academic medical center and with the community. And so we want to keep kind of letting them keep reaching out to the community, keep spreading the word, and keep helping people.
Yeah, okay. I'll definitely keep that in mind. So you mentioned something about being able to access people's health records. I think there's some confusion about health records, particularly now that so much of the healthcare is happening on the computer. So how are you all seeing patients now? Are you seeing patients only on the computer, partly on the computer, and what are there concerns you've heard about with respect to delivering healthcare via the computer?
Sure. So you're talking probably about two different things. One would be telehealth, which would be kind of a video visit, just like a video conference we're doing right now, where you could see your doctor and get healthcare. And I think that many doctors in the community right now, in DC especially, are offering a telehealth option for their patients. And while telehealth is probably not the perfect way to see your doctor for all conditions, it can be really great for minor care types of things, maybe a rash, maybe a medication refill, an adjustment to your hypertension medicines, your blood pressure medications, Those types of things can all be managed through telehealth. And so you should really reach out to your doctor and see if they have that option. It can be very simple. You can use it from your smartphone or your desktop, your laptop, and any of those things. And around concerns, you and your doctor together have to use good judgment as to whether it's the appropriate mode of communicating for that type of healthcare complaint. But we have a lot of privacy rules around healthcare, and so you should have a secure and private connection with your doctor through video, similar to this type of application we're using here today. And then the second part, I'll just quickly touch base on, I think you were talking about electronic health records, that we are entering all the information about your visit into a electronic health record. So you're probably, when you do come to see us in person, like when I see someone in the emergency room, they might feel like I'm spending a lot of time on the computer and not as much time with them. There's a lot of things that we have to document into our electronic health record. But that also makes all that information available to you if you download your patient portal. And so in our practice at the George Washington University, at the Medical Faculty Associates, we have a patient portal called Follow My Health. And I know that every healthcare system within the city has their own. And they would allow you to see your labs, maybe send a message to your doctor, schedule an appointment. So it really can make your managing your health simpler. And again, controlling your own data, taking it with you where you want to go.
Mm-hmm. Great. So how are you tracking the epidemic? There's a lot of data flying around. When you need information about coronavirus in DC, what do you do?
So I think this crosses exactly into digital health. There's so much information about coronavirus right now. So I would go to the coronavirus.dc.gov. I think our city has done an excellent job providing us real-time, very up-to-date information about what's going on across the city by ward, by group of, by race and ethnicity, even down to neighborhoods. And so if you're curious as to how this disease is spreading within your own neighborhood, you can find that out. Check out that website. It's updated every day. It'll tell you about the new cases. It'll tell you about the capacity for critical care in our city. It'll really give you a good sense of how we're doing and where things are today.
Mm-hmm. Great. So I can't end this interview without hearing about what you're seeing with respect to COVID and coronavirus. So you're an emergency room doctor, and I know the emergency rooms aren't quite as busy as they were before the pandemic, but you are probably still seeing a lot of people concerned about COVID. Anything you want to share? Any interesting aha moments or things that caught you by surprise, maybe?
Yeah, well, I think it's interesting. We are seeing, I think, a general trend towards a decrease in our COVID cases in the emergency room. And so that's good news. Less critically ill patients. I think we're having more educated patients. People are learning more about this disease and presenting when they need help, when they're experiencing shortness of breath or more severe symptoms that they're worried about. So I will say that we're at the point now where we're also trying to get people back to work and things are reopening. So we're seeing people come into the emergency department because they might need a test to even go back to work.
Oh, wow.
And so I would, so that's an interesting, we didn't think about that 3 months ago, but there's a couple of different pieces of information that people should know. One is there's a lot of testing available throughout the city. And so you don't necessarily need to come to the emergency room for that test to get you back to work, because we don't want you to have to be, again, exposed to the healthcare environment if you don't need it. And so our urgent care centers have it. The city is still offering testing, and there's a variety of testing options available to you. Those are also available on that same website, the coronavirus.dc.gov, and you should check it out to see what's the closest and most convenient for you. The second is that you may not need a test to go back to work. You should really talk to your employer, because a lot of the recommendations now are moving to a symptom-based return to work, meaning if you meet certain criteria, your symptoms have improved, you haven't had a fever, and you're more than 10 days from your onset or your diagnosis, often you can get cleared to work just by those symptom criteria. So you want to check with your workplace to see if you really need that test.
So I have I want you to react to something, and it's related to the asymptomatic spread, because the data around asymptomatic spread, or spreading before you have symptoms or when you don't know you have COVID, those data are all over the place. But I just wonder, if you think about someone who gets a cold, before they realize they have a cold, they may have symptoms that are so minor, they don't think anything about it. So maybe they had a tickle in their throat, or maybe they, sneezed a few times throughout the day, and then the next day they felt sick, and the day after that they felt even sicker. Do you think that could be contributing to the asymptomatic spread? I guess what I'm asking is, do you think people are truly asymptomatic, or are we just less in touch with the symptoms, however early they may be, and we're saying we're asymptomatic when maybe we're not?
Yeah. So you may have seen this a couple of weeks ago when the World Health Organization came out with some recommendations, and they confused a lot of us because they talked about asymptomatic and pre-symptomatic. And it was a very kind of confusing terminology, if you remember that. So I think that's kind of what you're getting at, is that it's really, you can't differentiate between people who are kind of early in their symptoms with really mild symptoms and who are asymptomatic. They're probably just the same people in different gradations, right? Like some people say, when I get a sinus infection, it's always horrible. And some people say, I get a little bit of sinus congestion and I'm okay. So it's the same kind of idea that, you probably have some very minimal symptoms. And so, I mean, I think what that leaves us with is that we all have to be cautious all the time. We know that this is a very infectious disease, and it passes to people very easily. And so that's why it's so important to wear your face mask when you go out, because you're protecting other people, and you gotta build that community trust and get your friends, colleagues, and neighbors to wear their masks so they protect you. It's a really, really critical way. I mean, nobody in my family can leave the house without a mask, even the kids, and it's hard, and it's difficult. But if we're going to go somewhere where we're going to be around people, we're doing that because we want to make that same effort, that we want to protect other people from ourselves, assuming that we might be asymptomatic or pre-symptomatic.
Yeah. Have you seen anybody in the emergency room who's about to die from high CO2? That's another myth we're hearing. People don't want to wear a mask because it causes CO2 poisoning. No,
absolutely not. And I'll tell you, when I work in the ER, I wear the most tight, the most restrictive, right? The best mask, the N95 mask. And I wear that straight for 8 hours. And because we don't have enough of them, I wear another surgical mask on top of that. So I'm wearing 2 masks for 8 hours. And I'm tired at the end of my day, but I've never had any health consequences from it. And so when we go out, to the store or whatever, we're wearing these very nice cloth masks my mom sewed for us, and they're fine, and they will definitely not cause problems like that.
Yeah.
So, no worries. Masks are safe.
Yeah. Thank you for that reassurance. So, Dr. Sikka, it's been great talking to you. Is there anything else we should have talked about or that you want to share with the community before we go?
No, this is great. Everyone just keep up the hard work. It's, this COVID is going to be a long slog, so we have to be in for the long haul and got to be persistent and strong for it.
Yeah, I'm afraid you're probably right. So thanks again. It's always great and fun to talk to you. And we'll be in touch about the health desk workforce. I'm really excited about that.
Definitely. Sounds good.
All right. Thank you.